Hello everyone, my name is Dinah Romero and I will be your speaker for today's training, and today's topic is measles. Measles is a highly contagious severe disease caused by the rubella virus family of the paramyxovirus. According to the World Health Organization, before introducing the measles vaccine in 1963 and widespread vaccination, major epidemics occurred approximately every 2 to 3 years, and measles caused estimated 2.6 million deaths every year. Unvaccinated young children are at the highest risk of measles and its complications, including death. Unvaccinated pregnant women are also at risk. In addition, any non-immune person who has not been vaccinated or was vaccinated but did not develop immunity can become infected. Measles is still common in many developing countries, particularly in the parts of Africa and Asia. However, overwhelming majority, more than 95% of measles deaths occur in countries with low per capita incomes and weak health infrastructures. Measles outbreak can be particularly deadly in countries experiencing or recovering from a natural disaster or conflict. In addition, damage to health infrastructure and services interrupts routine immunization, and overcrowding in residential camps significantly increases the risk of infection. Per CDC reports, measles can cause serious health complications, especially in children younger than 5. About 1 in 5 people in the U.S. who get measles will be hospitalized. 1 out of 1,000 people with measles will develop brain swelling, which could lead to brain damage. 1 to 3 out of 1,000 people with measles will die even with the best of care. The first sign of measles is usually high-grade fever, may spike to more than 104 degrees Fahrenheit, which begins about 10 to 12 days after exposure to the virus and lasts 4 to 7 days. A runny nose, cough, red and watery eyes, and small white spots inside the cheeks can develop in the initial stage. After several days, a rash erupts, usually on the face and upper neck, and eventually reaching the hands and feet. The rash lasts 5 to 6 days and then fades. Most measles-related deaths are caused by complications associated with the disease, which are more common in children under 5 and adults over 30. These include blindness, encephalitis, an infection that causes brain swelling, severe diarrhea and dehydration, ear infection, or severe respiratory infections such as pneumonia. Severe measles is more likely among poorly nourished young children, especially those with insufficient vitamin A or weakened immune system by HIV, AIDS, or diseases. It is usually passed through direct contact and through the air. When infected person coughs or sneezes, the virus infects the respiratory tract, then spreads throughout the body. Measles is a human disease and not known to occur in animals. According to CDC, measles was declared eliminated from the U.S. in 2000 thanks to the highly effective vaccination program. Eliminated means that the disease is no longer constantly present in this country. However, measles is still common in many parts of the world. Even if your family does not travel internationally, you could come into contact with measles anywhere in your community. Every year, measles is brought into the United States by unvaccinated travelers who get measles while in other countries. Anyone who is not protected can be at risk. There is no specific antiviral treatment exists for measles virus. Severe complications from measles can be reduced through supportive care that ensures good nutrition, adequate fluid intake, and treatment of dehydration. In addition, antibiotics should be prescribed to treat eye, ear, infections, and pneumonia. All children diagnosed with measles should receive 2 doses of vitamin A supplements within 24 hours apart. This treatment restores vitamin A levels during measles, even in well-nourished children, and prevent eye damage and blindness, and vitamin A supplements also been shown to reduce the number of measles deaths. You have the power to protect your child against measles with safe and effective vaccine. CDC recommends best protection against measles is the mumps rubella vaccine. MMR vaccine provides long-lasting protection against the strains of measles. Equally safe, effective in a single combined form. A total of 2 doses of MMR vaccine is needed for best protection. If your family travels overseas, the vaccine recommendations are slightly different. Please check with your pediatrician for travel requirements. Overall, routine measles vaccination for children and mass immunization campaigns, especially in countries with high cases and death rates, are critical for public health strategies to reduce global measles deaths. Measles vaccine has been used for nearly 60 years. It is safe and effective. Stay safe. Thank you for joining me today, and God bless.